Hello and welcome. I am Reverend Debbie Bergio, and today I am delighted to be joined by Dr. Diane Martin. Diane is the director of the GGEAR program at the University of Maryland Graduate School in Baltimore. Diane, welcome and thank you for joining us.
Well, thank you for having me, Debbie. I appreciate the invitation and the ability to share some information about our program and some of the happenings at University of Maryland, Baltimore. So thank you.
Oh, you are welcome. Excellent. So my first question is, can you please tell us what GGEAR stands for?
Yeah, so GGEAR stands for the Geriatrics and Gerontology Education and Research Program. It is a state-funded program that was developed in 1987 to support interprofessional education and research activities in the field of geriatrics and gerontology. And the idea is really to understand that older adults are unique from other age groups. So that idea that, you know, you turn 18 and everybody's the same, there's that general understanding, even when we think about different assessments and tools that we're using. And so then Governor Hughes recognized the growth in this population of older adults way back in the 1980s, and he set aside some funding to develop the GGEAR program. And the program is really designed to bolster the well-being of older adults and improve quality of later life. One of the misunderstandings that people have is they think about gerontology and geriatrics as interchangeable terms. And so we're the geriatrics and gerontology research and educational program. So geriatrics, as you probably know, is the branch of medicine that's focused on medical care and treatment of older persons. But gerontology is a scientific field of study, just the same way that biology is a scientific field of study and psychology is a scientific field of study. Gerontology is a field of scientific study that examines the biopsychosocial, spiritual processes and implications of aging, understanding that we don't age in a vacuum, right? That our physical well-being affects our emotional well-being, which affects our cognitive well-being and our social well-being, that it's an interplay between all of these different facets of our life that affects who we are as an older person.
That's such a great, I love that description, because you're looking at the whole person, not just one aspect of their lives.
Right. And that's really the importance, excuse me, I'm sorry, that's really the importance of our program is, you know, we tend to view an older person as, you know, his physical or her physical condition or, you know, their isolation. But the idea that our social interactions can impact either positively or negatively our physical health conditions. So that idea that we need to train people to look at the whole person, not just whatever physical health condition, chronic health condition brings them to the office, for example.
Excellent. So what do you see right now as maybe the top priorities or the top focus topics in gerontology?
Right now, it's obviously with COVID. So when we think about isolation and loneliness, you know, you think about the digital divide and people are saying, oh, older adults, it's hard to get them to connect through technology. And what we're learning is, no, it's not, right? They may not have access to it the same way younger people do, but when introduced to it and shown how to use it, they can use it just as effectively. And so there are some programs happening on how do you maintain or even increase the social connectedness of older adults through technology as we're living through this pandemic. And isolation and loneliness is not unique to the last year and a half. This has been something really on the forefront of aging as far back as I've been involved in aging. You know, as our networks decrease because of moves and death of family members or spouses, the social networks begin to decrease. And so social isolation, loneliness, which really are two different things, right? When we think about our social network, it's the number of people that we're engaging with, but loneliness is influenced by the quality of those relationships. So you could be involved in you know, a network of 4 or 5 people, but who are you actually connecting with? And who are you opening up with and sharing yourself, and how are you spending your time? And so that's what impacts our sense of loneliness. So that's really the big right now. And again, not just because of COVID, but really it predates COVID. That's one of the big things. Mental wellness, mental health is obviously a big issue right now also. You know, a lot of people think that depression is a normal part of the aging process. It's not, right?
No.
Statistically, about 20% of the population has a diagnosis of depression sometime in their lifetime, and it doesn't increase simply because now we're an older person. We're still at about 20%. But the way that people view older adults, you would think that it's much more prevalent than it is, right? And then, you know, misunderstanding between what's bereavement and what's depression, and is there a transition point from one to the other? And that's really the importance of becoming gero educated, is to understand these concepts, their implications, and how do you effectively treat? And so within our GGEAR program, our trainings are really focused on interprofessional education. Right. So the idea of interprofessional education is team-based collaborative practice. Right. And what we know is that when we get the physicians and the nurses and the social workers and the physical therapists working together as a team, that it increases the quality of life of that individual. And it also is more likely to result in safe practice care, or patient care, excuse me, safe patient care.
Sure. So, and the research programs that you're a part of in your department there, you mentioned to me when we talked previously about an age-friendly certification program.
Yeah, so University of Maryland, Baltimore in November 2019 became an age-friendly university, which is we're part of a global network. This started in Dublin, probably about a decade ago, and there are currently, I believe there's over 50 institutions worldwide that are part of it. And so jointly, University of Maryland, Baltimore and University of Maryland, Baltimore County were designated age-friendly universities in November 2019. So really just before the pandemic hit.
Right.
So the Agefriendly Network is a group of higher education institutions around the globe that endorse 10 principles of age-friendliness. And really what we demonstrate as being part of this network is our commitment to becoming age-friendly in both our programs as well as our university policies. And so the 10, if someone were to interested in age friendliness, they can look at the 10 principles, but it's being very purposeful in what we're doing. So it includes things like integrating older adults into our classrooms, right? Okay. So, you think about those people who are returning maybe after retirement or midlife, their second acts, and gaining education in new fields so that they can engage in their second act. So that's one piece of it. Maybe having someone who's in their 60s or early 70s or even later, coming back and getting their associate's degree or their college degree or their graduate degree in a different field so that they can continue to give back and find meaning in their lives that way. But it's also very purposefully integrating older adults as part of the classroom experiences to help train the younger generations. So the idea of not just lecturing to students about, later life and chronic health conditions in later life, but can we bring in older adults for these conversations with the students so the students can see the impact that this has on their quality of life and connect with older adults holistically, as opposed to something very abstract or a group that's very abstract with these health conditions. But this is a person behind whatever that condition is, or, caregiving when we're thinking about dementia, for example, and what impact does the caregiving and caregiver stress have on that person who's providing care. So it's integrating older adults more deliberately. So it's not just marketing our programs to them. We definitely want to do that, but also we want to integrate older adults into the conversations, into our teaching, so that students can begin feeling connections to the neighbors. We use the term neighbors. The neighbors are going to be interacting with, right? It's their patients. It's, when we think about lawyers and the interactions they have, and we are a professional campus, so we do have law and social work and nursing and pharmacy. And so we use this interprofessional education where we get our students training together to think about aging holistically. Some other pieces related to age friendliness, a more deliberate emphasis on integrating older adults into our research protocols. Right. So we have, when we think about just even with the drugs that were being, the medications that were being considered for COVID, and the typical age group of 18 to 55 or 60, we needed older adults. The pandemic was affecting older adults, and that's not typically who's participating in our research when we think about drug trials, for a variety of different reasons. But being very purposeful in recruiting older adults, not just into those type of clinical trials, but in other research initiatives that historically haven't been attractive for older adults, or researchers haven't sought out that population. So we're also encouraging our researchers across the university to reach out to this population and bring them into the research protocols as well. Age friendliness on campus, right? So the idea of it may take an older person a little bit longer to walk across the street. What's the timing of the street lights, right? And we don't want that person to be midway across and cars come speeding by. Right. So we're also doing landscape analyses because we want older adults on our campus. So we're doing landscape analyses to see how age friendly is our campus, right? What are directories? What are the speed bumps, so to speak, and how might we be able to correct that? And as older adults are staying in the workplace longer, what policies, what procedures need to be in place? What training do we need for these intergenerational workforces to work collaboratively together? So we are very mindful of both the needs on campus as well as society as a whole. And we're involved in some of the age-friendly health system initiatives, the age-friendly community initiatives, the dementia-friendly initiatives that are happening across the state. So really at University of Maryland, we've taken these 10 age-friendly principles that are part of this global network, and we've kind of boiled it down to our 5 key areas of workforce development, where we want more people being trained to work with geriatric patients and neighbors, so social workers, to receive that type of training so they can effectively work. Broadening our community engagement, right? Thinking about the health and wellness programs that exist and how do we engage older adults, expanding opportunities to participate in research and then disseminating those findings. And number 4 would be addressing barriers in our own environment. And then what I said before, our number 5 is these age-friendly efforts that are really happening across the state, becoming very purposefully engaged in those as well.
It's really an exciting area of research because, I mean, the population as a whole is aging, and I believe it's by 2030, there'll be more people over 65 than there are under 18. So
yeah, by 2034, so not too far down the road.
Yeah. We at Winter Grace, we're really just starting to talk about the idea of what age-friendly churches look like, and I'll be doing research on what you have available. We're talking about, how can we encourage churches to be more accessible, friendly, and holistic in caring for and ministering with and for older adults. So it's it is a timely topic for sure.
Absolutely. Yeah. We actually got a lot of pastors coming into our various programs because the congregation is aging as well, and how do we minister to them, especially now during the pandemic, right?
Actually, it has, and it's certainly been a challenge, that is for sure. There have been a lot of porch visits, 6 feet away porch visits, Zoom, telephone calls, trying to be creative and figure out what those new or revisiting some old ways. Like I said, just sitting on the front porch and talking with someone. It requires flexibility and creativity.
Right, right, exactly, exactly.
So the programs at the University of Maryland, I know you obviously have graduate programs, but are there also other things for maybe interested civilians, for lack of a better term on the top of my head?
Yeah, so
learn?
as part of our Age-Friendly University Initiative, we launched the Age-Friendly Specialist Certificate of Achievement Program.
Okay.
And that is really designed for anyone who is currently working with older adults or on behalf of older adults, for family members, for older adults themselves, anyone who has an interest in aging processes, because, you know, knock on wood, we're all going to get there one day. So to understand our own aging course. So it really is open to anyone. It's a non-academic program. Mm-hmm. And so, you know, there's no coursework. You don't have to meet with a register and sign up for classes or anything like that. It's a program that's based on offerings that are already happening around the state. So what we are doing is kind of cataloging what Maryland Department of Aging is doing, what we're doing here at University of Maryland, Baltimore, what's happening on the Eastern Shore and Western Maryland, Central Maryland, these different regions of our state, what's happening with the Alzheimer's Association. And we've created this Certificate of Achievement program to be 100 contact hour by attending the workshops, the seminars, the conferences that are happening across the state. Over a 2-year period, if you complete 100 hours in the various offerings based in 2 categories. So one of our categories is knowledge categories. So for example, understanding physical changes of aging or chronic health conditions, it's psychological aspects of aging, ethics in aging. So those are kind of fall into this category of knowledge. And the other piece of it, the other half of it, is skill categories. So things like effective communication or medication management, geriatric care management, if you know, as you're thinking about the resources and navigating the systems. So people who register for this program, it's a $50 application fee. And that application fee basically is our way of putting you into our system that allows us to put you into our system and keep track of which programs you're attending and the number of hours you need to complete. 50 knowledge hours or 50 events related to knowledge and 50 contact hours related to skills. And if you do that within a 2-year period, you would receive our Certificate of Achievement, Age-Friendly Specialist Certificate of Achievement certificate. And that's, you know, you're being introduced to important concepts that will improve the quality of your relationships with your older family members by just understanding, you know, some of the changes that they're experiencing. It's one thing to watch what this person is and maybe hear them complain, but to understand, it connects you with that person on a different level, and learning effective communication levels so that, you know, sometimes we can be short-tempered with our older relatives. And so when we can understand what's happening with them, it changes the way that you're interacting. It's changing the way that you're thinking about not just that person. And that's really where we are, is that individualized aspects of aging, right? That each of us is an individual and we have to get to know the individual and respond to their needs, this person-centered environment that we live in. And so for yourself, for your aging family members, we're to improve the quality of the work that you're doing. You do get a certificate, so if you are working in aging services or long-term care, it's something that can go into your portfolio to illustrate that you are committed to your job and you know, seeking advancement, not advancement, but knowledge advancement, I should say. Our program, so it's a $50 application fee. Each workshop price is set by the agency that would be delivering it. So there are some that are free and there are some that may have a cost associated with it. And so that would all be made available as well. So when people are registering, we would give them a list of workshops that are coming up every quarter, along with the contact information, the fee price, and things like that. So.
And where would we go to register for this?
Yeah, so if you go to our website, which is www.umaryland.com/gerontology, and that takes you to our website where you can find more information about the Age-Friendly University Initiative,
Great.
my program, GGEAR, and others. And on that page, you'll see education and training. Click that link, and that'll take you to the registration material for this Age-Friendly Specialist Certificate of Achievement program.
That's excellent. It seems like the state of Maryland is really at the forefront of aging research. I know that the Department Office of Aging for the state is very active, and you were mentioning before about a dementia capable, I'm sorry, the term.
They have a what's called the Alzheimer's disease related disorders dementia capable project, and that's a coalition of between the state, Johns Hopkins is involved, University of Maryland is involved, Keswick, which is a senior care, is involved in it, and it's through a national grant, and to develop resources and, again, knowledge, the importance of knowledge related to dementia and effective communication with dementia, and when what's raising red flags to make those referrals. And so there's a lot of education happening within the areas of aging, the area agencies on aging. So I'm sure if you go to the Maryland Department of Aging website, you can find some information about that as well. So.
I'll definitely look for that and put that contact information on this page as well. And so I know you're in the research department, and we talked previously about there are some research opportunities that older adults may be interested in. I was wondering if you could touch on that for just a moment.
Yeah, we have so much that's happening that if someone is interested in research, again, if they go to our website, umaryland.edu/gerontology, you'll see a tab for research programs. And you can click on any of those to learn more. We've got a Center for Research on Aging. We have a Biology and Behavior Across the Lifespan Research Center. We have the Peter Lamy Center on Drug Therapy and Aging. So there's about 6 different programs that are involved in aging research across our campus. So again, the best place to go to learn more about the research initiatives is to our website, and just click the link for research. Click any of those buttons for more information, and then you'll also get contact information for the different research investigators.
It's definitely a wealth of information on your site. It's impressive how much is going on and the resources that are available. What is there anything else that you would like us to know about? What?
No, but I think it's important that everyone, regardless of whether you're an older adult yourself or a family member, or you're working in the aging service industry or the healthcare industry, that you familiarize yourself with concepts related to geriatrics and gerontology, just taking advantage of all of the different conferences and workshops and seminars that really are available across the state. A lot of people think about older adults in a very stereotypical fashion based on what we see on television, for example. Yep. Or we all have the stereotype of our Uncle Al, when he gets older. But it's so much different than that. And so we as a society really do need to and are moving toward this person-centered approach where we get to know the individuals and respond to them as the individual, as opposed to the stereotype of being an older adult and reacting to that. And that's really what age education allows us to do.
Absolutely. I mean, you meet someone who was older, and sometimes we forget they had a whole life experience before. Exactly. They've lived a whole life, and to get to know the whole person, their history, their story, and it's just so important. Shifts our perspective too when you have the knowledge of what are some of the myths of aging and what are the realities of aging. Just shifts perspectives and understanding, and just so important.
Right, absolutely.
Well, Diane, thank you so much for joining us. I just can't thank you enough.
Yeah, you're very welcome. Thank you for having me.
Have a great day.
Okay, you too. Bye.